We are joined today by Ed Kelly, the CEO of the Corvallis Clinic, one of the primary healthcare providers here in Benton County. Ed is also a board member for the Corvallis Clinic Foundation, which works in the Mid-Willamette Valley and Central Coast region to provide health education, preventative care, and help delivery of healthcare to at-risk populations. Ed, thanks for joining us today.
Thanks for having me.
Well, how's life at the Corvallis Clinic? How has COVID-19 changed things for you? I imagine pretty dramatically.
Yes, it has. Not unlike other healthcare providers around the country, around the world. It's definitely had a significant impact on the volume, which has brought about, people have been concerned about coming in and getting infected by the virus. And what we're saying to people is that we're open for business. It's safe to be seen. And also, we have to also be compliant with the state laws and the executive orders from Governor Brown to see what we call essential visits. So right now, we're not scheduling non-essential visits, and that includes surgeries and procedures. So right now, we're seeing effectively patients who really need to be seen, and we want to make sure that the people that do have conditions that do need to be seen, that they are seen on a timely basis.
It seems like healthcare providers are strained everywhere, even in communities that don't have a major problem with the virus at this point in time. Not seeing as many patients can have a major impact on the business and on the ability to provide healthcare down the road. Are you seeing that in terms of revenue and kind of question marks about how you're going to be able to provide healthcare in the future?
Yeah, again, not unlike our other colleagues in medicine in this country and around the world, we've taken a significant downturn in our volume. It's over 50% of our volume has gone down as a result of the COVID-19 outbreak. So we've had to put a very large number of people on furlough, some layoff condition, and also compensation adjustments all around for our providers, for staff, for management, in order to weather the storm financially. So we do feel confident, though, that we will get through this. We're seeing an uptick in our volume basically it's our second week of what we call our recovery plan. It's a 3-month plan. We hope that this COVID virus is less than that, but we're ready for a longer term if necessary. But yeah, it's had a significant impact on our current operations, but we welcome and look forward to getting back to normal operations once we get through this.
And we know that we're in a community that has not been as affected by many others by the virus, but we do have cases. Certainly, Oregon has many cases, although we're in a better position than many other parts of the country. Are you seeing anyone present, or what are you expecting in terms of the coming weeks when it comes to the virus?
Well, we haven't had too many positive cases, but we're still in the early stages. For the state of Oregon, latest predictions is the latter part of April being the peak of positive cases for Oregon. That constantly changes, though. And so we have had a few positive cases, but not very many. Nothing like New York or New Orleans, other parts of the country. But we are ready for it, though. We're also collaborating with Good Samaritan on contingency plans if we do have a significant wave of positive COVID cases.
And how prepared are you with PPE, protective gear for your doctors and nurses, people seeing patients?
Yeah, right now we are not in a critical situation. We're doing okay, and we are utilizing PPE very judiciously, but safely to protect our patients, protect our staff, protect our providers. And so we want to make sure we also do, if we do get a significant wave of positive COVID cases and people suffering from COVID-19, that we have the PPE available. So we're doing okay. We don't have a huge supply. We're welcome donations from the community, and we've received many donations from the community, which has just been a fantastic part of this crisis, is the outpouring of support from our local communities, such as getting PPE or masks from construction companies, from painting companies, from other industries, and also people making homemade masks too. We're starting to collect a large number of those masks as well.
I'm really glad to hear it. I'm really sorry to hear about the impact that all this is having on your staff and the operation, and really hope for a quick resolution to all this. Do you have just a message for the community? I mean, you're at the front lines of providing health care here. You guys do a really great job of it. And is there anything you want the community to know right now?
Well, again, just want to reiterate, we are here for you. If you're concerned, give us a call. We're here to treat you. The Corvallis Clinic has been around this area for 73 years. We're going to get through this. We want to be around for the next 73 years. So that's the message, is that we are open for business and are here to take care of you.
Ed, we really appreciate that. I really appreciate your time today. I know you're a very busy person. This has been Ed Kelly with the Corvallis Clinic and the Corvallis Clinic Foundation. This is Sev Williams with the Benton County COVID Connection. And Ed, thanks again. I hope to see you sometime soon.
Okay, thank you, Sev. Thanks very much.